101. Which hormone is primarily responsible for regulating water balance in the body? Answer: antidiuretic hormone. Explanation: antidiuretic hormone, secreted by the pituitary, regulates water retention, critical for assessing fluid balance in endocrine disorders like diabetes insipidus. 102. What is the primary nursing action for a patient with a blood glucose level of 55 milligrams per deciliter who is sweating? Answer: provide oral glucose. Explanation: providing oral glucose corrects hypoglycemia in a symptomatic patient, a critical intervention to prevent neurological complications and ensure safety. 103. Which gland is responsible for cortisol secretion? Answer: adrenal gland. Explanation: the adrenal gland secretes cortisol to regulate stress and metabolism, critical for assessing endocrine function in disorders like Cushing's syndrome. 104. What is the primary symptom of a patient with diabetic gastroparesis? Answer: nausea after eating. Explanation: nausea after eating, due to delayed gastric emptying in diabetic gastroparesis, guides dietary management to improve endocrine patient comfort and nutrition. 105. What is the priority nursing action for a patient with suspected hyperthyroidism crisis? Answer: administer propylthiouracil. Explanation: propylthiouracil inhibits thyroid hormone synthesis in thyroid storm, a critical intervention to reduce metabolic rate and ensure patient safety in emergencies. 106. What is the primary patient education topic for a patient with type 1 diabetes using an insulin pump? Answer: pump maintenance. Explanation: teaching pump maintenance ensures accurate insulin delivery, a critical step to prevent glucose fluctuations and ensure endocrine patient safety. 107. Which laboratory test confirms primary adrenal insufficiency? Answer: low cortisol with high ACTH. Explanation: low cortisol with high ACTH confirms primary adrenal insufficiency, guiding hormone replacement to restore endocrine balance and patient stability. 108. What is the primary nursing intervention for a patient with hypothyroidism experiencing fatigue? Answer: monitor thyroid function tests. Explanation: monitoring thyroid function tests ensures adequate levothyroxine dosing, a critical intervention to alleviate fatigue and support endocrine patient health. 109. Which hormone is oversecreted in a patient with Conn's syndrome? Answer: aldosterone. Explanation: excess aldosterone in Conn's syndrome causes hypertension, guiding endocrine assessments and interventions to manage fluid and cardiovascular risks. 110. What is the primary symptom of hypernatremia in a patient with diabetes insipidus? Answer: thirst. Explanation: thirst, due to elevated sodium from water loss, signals hypernatremia, guiding fluid replacement to restore balance and ensure endocrine patient safety. 111. Which gland is responsible for thyroid-stimulating hormone secretion? Answer: pituitary gland. Explanation: the pituitary gland secretes thyroid-stimulating hormone to regulate thyroid function, critical for assessing endocrine disorders like hypothyroidism. 112. What is the primary nursing action for a patient with a blood glucose level of 450 milligrams per deciliter? Answer: notify the healthcare provider. Explanation: notifying the healthcare provider ensures rapid intervention for severe hyperglycemia, a critical step to prevent ketoacidosis and ensure patient safety. 113. Which hormone is deficient in hypoadrenalism? Answer: cortisol. Explanation: cortisol deficiency in hypoadrenalism causes fatigue, guiding hydrocortisone therapy to restore endocrine function and patient energy levels. 114. What is the primary patient education focus for a patient with hyperparathyroidism? Answer: monitor calcium intake. Explanation: teaching calcium intake monitoring prevents hypercalcemia complications, a critical step to ensure endocrine stability and patient skeletal health. 115. Which laboratory test monitors insulin therapy effectiveness in diabetes? Answer: hemoglobin A1C. Explanation: hemoglobin A1C reflects long-term glucose control, guiding insulin adjustments to prevent endocrine complications and ensure patient health. 116. What is the primary nursing intervention for a patient with suspected hyperosmolar hyperglycemic state? Answer: administer intravenous fluids. Explanation: intravenous fluids correct dehydration in hyperosmolar hyperglycemic state, a critical intervention to stabilize endocrine function and prevent organ failure. 117. Which hormone is oversecreted in a patient with acromegaly? Answer: growth hormone. Explanation: excess growth hormone causes enlarged features in acromegaly, guiding pituitary assessments and interventions to manage endocrine complications. 118. What is the primary symptom of a patient with diabetic peripheral neuropathy? Answer: tingling in extremities. Explanation: tingling in extremities, due to nerve damage, guides neurological assessments and foot care to prevent injury in diabetic neuropathy patients. 119. What is the primary nursing action for a patient with a blood glucose level of 35 milligrams per deciliter who is unresponsive? Answer: administer glucagon. Explanation: administering glucagon raises blood glucose in unresponsive hypoglycemic patients, a critical intervention to restore consciousness and ensure patient safety. 120. Which gland is responsible for calcitonin secretion? Answer: thyroid gland. Explanation: the thyroid gland secretes calcitonin to regulate calcium, critical for assessing bone health in endocrine disorders like hyperparathyroidism. 121. What is the primary patient education topic for a patient with hypothyroidism? Answer: lifelong levothyroxine therapy. Explanation: teaching lifelong levothyroxine therapy ensures consistent thyroid function, a critical step to prevent complications and maintain endocrine patient health. 122. Which hormone is deficient in a patient with Sheehan syndrome? Answer: multiple pituitary hormones. Explanation: Sheehan syndrome causes multiple pituitary hormone deficiencies, guiding hormone replacement to restore endocrine function and patient stability. 123. What is the primary nursing intervention for a patient with suspected diabetic ketoacidosis? Answer: administer intravenous insulin. Explanation: intravenous insulin lowers blood glucose and halts ketone production in diabetic ketoacidosis, a critical intervention to reverse acidosis and ensure patient safety. 124. Which laboratory test confirms hyperaldosteronism? Answer: elevated aldosterone to renin ratio. Explanation: an elevated aldosterone to renin ratio confirms hyperaldosteronism, guiding treatment to manage hypertension and ensure endocrine patient health. 125. What is the primary symptom of hypokalemia in a patient with hyperaldosteronism? Answer: muscle weakness. Explanation: muscle weakness, due to low potassium, signals hypokalemia, guiding electrolyte replacement to prevent neurological complications and ensure safety. 126. What is the primary nursing action for a patient with a blood glucose level of 250 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers elevated blood glucose, a critical intervention to prevent hyperglycemia complications in endocrine care. 127. Which hormone is oversecreted in a patient with Cushing's disease? Answer: cortisol. Explanation: excess cortisol in Cushing's disease causes weight gain, guiding endocrine assessments and interventions to manage metabolic complications and patient health. 128. What is the primary patient education focus for a patient with type 2 diabetes? Answer: regular exercise. Explanation: teaching regular exercise improves insulin sensitivity in type 2 diabetes, a critical step to prevent complications and ensure endocrine health. 129. Which gland regulates metabolism through thyroid hormone? Answer: thyroid gland. Explanation: the thyroid gland secretes thyroid hormone to regulate metabolism, critical for assessing energy levels in endocrine disorder management. 130. What is the primary nursing intervention for a patient with suspected adrenal crisis? Answer: administer intravenous hydrocortisone. Explanation: intravenous hydrocortisone replaces cortisol in adrenal crisis, a critical intervention to prevent shock and ensure patient safety in endocrine emergencies. 131. Which hormone is deficient in Graves' disease? Answer: none. Thyroid hormone is oversecreted. Explanation. Graves' disease involves oversecretion of thyroid hormone, guiding antithyroid therapy to normalize metabolism and ensure endocrine patient stability. 132. What is the primary symptom of a patient with diabetic foot ulcer? Answer. Non-healing wound. Explanation. A non-healing wound signals diabetic foot ulcer, guiding wound care and glucose control to prevent infection and ensure endocrine patient safety. 133. What is the primary nursing action for a patient with a blood glucose level of 600 milligrams per deciliter? Answer. Notify the healthcare provider. Explanation. Notifying the healthcare provider ensures rapid intervention for severe hyperglycemia, a critical step to prevent hyperosmolar state and ensure patient safety. 134. Which laboratory test monitors thyroid function in hyperthyroidism treatment? Answer. Free thyroxine. Explanation. Free thyroxine levels guide antithyroid drug dosing in hyperthyroidism, ensuring optimal thyroid function and patient endocrine health. 135. What is the primary patient education topic for a patient with Cushing's syndrome? Answer. Monitor for osteoporosis. Explanation. Teaching osteoporosis monitoring reduces fracture risk in Cushing's syndrome, a critical step to ensure skeletal health and endocrine patient safety. 136. Which hormone is oversecreted in a patient with pheochromocytoma? Answer. Catecholamines. Explanation. Excess catecholamines cause hypertension in pheochromocytoma, guiding endocrine assessments and interventions to manage cardiovascular risks. 137. What is the primary nursing intervention for a patient with suspected hypoparathyroidism? Answer. Administer calcium supplements. Explanation. Administering calcium supplements corrects hypocalcemia and hypoparathyroidism, a critical intervention to prevent neurological complications and ensure safety. 138. Which gland is responsible for adrenocorticotropic hormone secretion? Answer. Pituitary gland. Explanation. The pituitary gland secretes adrenocorticotropic hormone to stimulate cortisol production, critical for assessing adrenal function in endocrine disorders. 139. What is the primary symptom of hyperthyroidism in older adults? Answer. Fatigue. Explanation. Fatigue, often atypical in older adults with hyperthyroidism, guides thyroid assessments and interventions to restore energy and ensure patient stability. 140. What is the primary nursing action for a patient with a blood glucose level of 80 milligrams per deciliter before a meal? Answer. Monitor for symptoms. Explanation. Monitoring for symptoms ensures early detection of glucose changes, a critical step to maintain endocrine stability and patient safety before meals. 141. Which hormone is deficient in a patient with panhypopituitarism? Answer. All pituitary hormones. Explanation. Panhypopituitarism involves deficiency of all pituitary hormones, guiding comprehensive hormone replacement to restore endocrine function and patient health. 142. What is the primary patient education focus for a patient with diabetes insipidus? Answer. Maintain hydration. Explanation. Teaching hydration maintenance prevents dehydration in diabetes insipidus, a critical step to ensure fluid balance and endocrine patient safety. 143. Which laboratory test confirms acromegaly? Answer. Elevated insulin-like growth factor, 1. Explanation. Elevated insulin-like growth factor, 1 confirms excess growth hormone in acromegaly, guiding pituitary treatment to manage endocrine complications. 144. What is the primary nursing intervention for a patient with suspected thyroid cancer? Answer. Prepare for diagnostic imaging. Explanation. Preparing for diagnostic imaging facilitates thyroid cancer diagnosis, a critical step to ensure timely endocrine treatment and patient safety. 145. Which hormone is oversecreted in hyperparathyroidism? Answer. Parathyroid hormone. Explanation. Excess parathyroid hormone causes hypercalcemia, guiding endocrine assessments and interventions to manage skeletal and neurological complications. 146. What is the primary symptom of a patient with diabetic ketoacidosis? Answer. Fruity breath odor. Explanation. Fruity breath odor, due to ketone production, signals diabetic ketoacidosis, guiding urgent insulin therapy to reverse acidosis and ensure patient safety. 147. What is the primary nursing action for a patient with a blood glucose level of 150 milligrams per deciliter postmeal? Answer: document and monitor. Explanation: documenting and monitoring post-meal glucose ensures accurate tracking, a critical step to adjust therapy and maintain endocrine patient stability. 148. Which gland regulates blood pressure through renin secretion? Answer: kidney. Explanation: the kidney secretes renin to regulate blood pressure via the renin-angiotensin system, critical for assessing fluid balance in endocrine disorders. 149. What is the primary patient education topic for a patient with adrenal insufficiency? Answer: wear medical alert bracelet. Explanation: teaching patients to wear a medical alert bracelet ensures rapid crisis recognition, a critical step to prevent shock and ensure endocrine safety. 150. What is the primary nursing intervention for a patient with suspected hypernatremia? Answer: administer hypotonic fluids. Explanation: administering hypotonic fluids corrects hypernatremia, a critical intervention to restore fluid balance and prevent neurological complications in endocrine care.